Dear students, welcome to the learning series. Today we are going to learn about infections and pathogens, the causative agents. What is patho? Patho means disease and gen means generator. The first and severe most infection is meningitis, which occurs in the layer of brain, the meningeal layer of brain. The meningitis is caused mainly by Neisseria meningitis, and the major symptoms are fever, headache, stiff neck, sensitivity to light, that is photophobia, nausea, vomiting, and confusion and altered mental state. The second one is upper respiratory tract infection. Just hold your hand at the neck and check what is there at the top of your hand. That particular part is called as upper respiratory tract. Example: nose, sinus, pharynx, and larynx. And the infection happen in this area is called as laryngitis, pharyngitis, sinusitis, and common cold. The commonly causing agents are Streptococcus pneumonia, Moraxella catarrhalis, and common cold viruses, and Streptococcus pyogen and Neisseria gonorrhea. The next one is lower respiratory tract infection. So same below the neck up to your chest part is called as lower respiratory tract, which composed of trachea, bronchus, lungs. And the infection happen in this area is called as tracheitis, bronchitis, pneumonia, and accumulation of pus in the lungs we called as abscess or pneumonia. The commonly causing bacteria are SRS, pneumonia, catarrhalis, and influenza. The next infection is pneumonia. So pneumonia is generally called as CAP, that is community acquired pneumonia. So if it is caused by gram positive, the bacteria is Streptococcus pneumonia, and the gram negative bacteria causes this disease are Haemophilus influenza, Klebsiella pneumonia, E. coli. You can able to see here, this is our normal lungs alveoli, and this is the pus accumulated alveoli. Tuberculosis. Tuberculosis is commonly affecting your lungs and one of the severe infection which is communicable and contagious too. It spread more faster and it is caused by Mycobacterium tuberculosis. The severity of the infection will concluded with the symptoms such as fever, weight loss, nighttime sweating, and at the end, blood containing mucus. Pseudomonas infection. Pseudo means false. Generally, this pseudomonas infection always misdirect the antibiotics. That's why many a time antibiotic fail to kill this bacteria. So generally, it affects the respiratory tract infection, and if it is not treated properly, it goes to cystic fibrosis, and it affects almost all the parts of our internal system, our skin, CNS, localized infection, bacteremia, urinary tract infection, and respiratory tract infections. Typhoid fever. Typhoid fever is commonly caused by Salmonella typhi, and the severity increases with the severity nature of the particular bacteria. So the bacteria now we can found more smarter and causes more severity to the patient. What are all of the symptoms they cause? They cause us high fever, chill, loss of appetite, stomach or abdominal pain, rose spots, muscle ache, headache, cough, and severe nausea and vomiting, and continuous diarrhea or constipation. The severity increases with the nature of the bacteria and its species. Intra abdominal infection. Intra, we know that inside, and abdominal infection. This infection generally caused by E. coli, Klebsiella pneumonia, and bacteriocytes. And if it occurs in gastric, that is our stomach, we call it as gastritis. And if it affects in our small and large intestine, we call that as enteritis. And if it affects in between the layer of small intestine, we call it as periodontitis. And if it affects on the appendix layer, then we call it as appendicitis. Next infection is E. coli infection, the most common infection in our GI system. It always identified with the symptoms of high fever with watery to bloody stool which happens, and the general organ it affects is kidney. Sometimes if it is untreated it leads to death. The next one is urinary tract infection. If the infection happen in the urethral area, we called as uncomplicated urinary tract infection, so that it needs less and low dose and dosage for the treatment. But the same infection gets spreaded into your ureter and your kidney, we called as complicated urinary tract infections. Uncomplicated urinary tract infections and even urinary bladder uncomplicated urinary tract infection and ureteritis, and then py- pyelonephritis and complicated urinary tract infection when it reaches kidney. Gonorrhea, otherwise the disease which is caused by Neisseria gonorrhea, or we sometimes called as the clap, because it need the contact of two people, those who are having physical interaction or intercourse. It is the second most sexually transmitted disease in United States. The first one is AIDS. If it is if it is not treated properly, it will lead to infertility in case of the patient who not treated with properly with gonorrhea. So these are the common symptoms of gonorrhea: urinary incontinence, conjunctivitis, anal itching, pain during sex, painful urination, and itching in the reproductive organs. All are the symptoms of gonorrhea. Another sexually transmitted disease is syphilis. This is again an activity which happened because of physical contact between each other or prolonged kissing between the person suffering from the bacterium Treponema pallidum. The common organ which affects our eyes, brain, and joints. The most common and one of the pandemic of 90s kids is cholera. The cholera is spreaded by Vibrio cholerae, and it happened because of drinking contaminated water. And you can able to see the flagella, which is a tail-like structure of this bacteria, which is a main reason for the bacteria which spread more faster and killed almost maximum people during 19th century. The next one is skin and soft tissue infection. Generally, if the infections are moderate to normal to moderate, we never call that as a skin soft tissue infection. But if it is spreaded beyond its level, like skin burn or severity, then we call that as a skin and soft tissue infections. So generally it is caused by Staphylococcus aureus, and the severe infections are caused by methicillin